Hi. So now you have seen a baby motionless on the road, on the floor, anywhere in the house. So what should you do? First thing is ensure scene safety. That is, please move the baby to a safe place. Suppose there is a fire nearby, you have to move the baby away. Suppose you are on the road. If you have red triangles, you can put them around 45 to 50 meters all around to warn the vehicles. So first, scene safety. Yes, you have ensured that you have moved the baby to a safe place. What do you do next? Assess the level of consciousness. Check whether baby is responsive or not. So how do you check whether a baby is responsive or not? Okay, so tap on the sole and shout to the baby. Hello baby, hello, hello, hello baby. Shout loudly. Okay, if the baby opens his eyes or moves a little bit or blabbers something, so the baby is conscious. So what do? You have to immediately arrange for medical help, and you can use your cell phone, and if you have to move from the place, please carry the baby with you. Suppose the baby is not conscious, baby has not responded to you. Okay, so what do you do next? You will have to check for breathing. Now, here we have a baby who is not conscious. What to do next? We'll have to check whether baby is breathing or not. If there is someone to help you, please send them to get help, but you get to checking for the breathing. So how do we check whether the baby is breathing or not? Okay, so please use your one hand to tilt the forehead gently and slightly, and lift the chin with the other hand using the forefinger. Make sure you don't press on the soft part of the neck. And if you see that there is anything in the mouth which is easily removable, please remove it. Never do blind poking or try to poke your finger too deep. You may actually push the food or any other thing in the mouth deeper down into the airway and cause more problems. Only if it is visible and easily removable, please remove. Now, how to check for breathing? Tilt the forehead gently, lift the chin and look at the chest, see if it's rising. Feel for the breath on your cheek and listen to the breath. Do not spend more than 10 seconds in this process. So, look, listen and feel. If the baby is breathing normally, please put the baby in recovery position. How do you put the baby in recovery position? So, hold the baby in such a way that head, neck and back are well supported. The baby is slightly leaning downwards and turn to one side. Why? So that all the secretions, saliva, vomiters, everything drain out, and also the tongue doesn't fall back and choke the baby. And holding the baby thus, you should ensure that you get some medical help. Wherever you go, please take the baby with you in the recovery position. Now, actually the baby is not breathing. Baby is gasping or not breathing. What do I do next? Assume that the heart is not beating and please proceed to doing CPR. What is CPR? Cardiopulmonary resuscitation. So, you are going to do certain maneuvers which will help the heart to beat and the lungs to breathe. They have actually stopped. Now you have to get them going. So, how do you do it? So, first you have to learn how to give chest compressions and you have to learn how to give breaths. So, how do you give chest compressions? Just below the nipple line, the line joining the nipples, just below that, on the breastbone. Use 2 fingers to give deep thrusts. 1, 2, 3, 4, 5. So, the depth should be at least 1.5 inch, that is around 1/3 of this diameter, and at a rate of approximately 100 per minute. And when you do the thrust, please allow the chest to recoil, allow it to come back. Okay. So, next, how do we give breaths? How to give breaths? So, tilt the forehead, lift the chin, making sure you do not press on the soft part of the neck. Take a nice deep breath, seal the nose and mouth well, and breathe in for at least 1 second. So, this is how you give breaths. So, how do I go about it? You should give 30 chest compressions and 2 breaths, 30 chest compressions and 2 breaths, at least 5 cycles, that is spread over 2 minutes before you go for help, especially if you are the only rescuer. If there are 2 of you, then one can go for help while you are doing the CPR. Till when do I continue doing this CPR? Till you revive the baby, or till expert help arrives, or till you are too exhausted to carry on further. If you are too exhausted, please hand over to somebody to do the CPR. Okay. Fine. You have revived the baby. What do you do now? Please put the baby again in recovery position. Hold the baby in recovery position and then arrange for medical help. Suppose you want to protect yourself, you can use a hanky as a barrier between your mouth and the baby's mouth. If you are not comfortable giving breaths or you are not able to give effective breaths, please stick to chest compressions at the rate of 100 per minute, not more than 120 per minute. Now, let's have a quick recap. Check for consciousness level. If baby is not responsive, please check for breathing. Ensure that there is nothing stuck in the mouth. If anything is visible and easily removable, please remove. If the baby is breathing well, hold the baby in recovery position and arrange for help. What to do when a baby is unconscious and is not breathing? Please proceed on to do the CPR. First, give 30 chest compressions at the rate of 100 per minute. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, and give 2 breaths. So, now 30 chest compressions, 2 breaths, 5 cycles, and please arrange for help if you have not already arranged, and continue this till help arrives or till you are exhausted or you have revived the baby. If you have revived the baby, please put the baby in recovery position.
Please subscribe to this channel and give this video a big thumbs up.
We do want to make a difference.